how will I see this complete oval apex? How can I do it? I cannot do it because there is already an isthmus in between. Maybe a trauma, maybe a cavernous lesion long time. You never know. Sometimes patient doesn't have any history. Maybe an orthodontic forceps. Patient was quite young. Maybe this thought came to my mind right now when I'm talking. But big. You open it up, and then first I have to have, as I said, accessibility to the apical area. So I have to remove this. So I use again the ultrasonic tips to remove that isthmus which is in the root canal, so that I can place my bioceramic completely three-dimensionally into those apical areas. That's what we did. And after using ultrasonic, this what you can see. Now I have a complete clean canal, open canal, and this is the apical area of resorption which I can see. So let's go. Now, first thing is what? You have to place a calcium hydroxide in such cases. Right? We place a calcium hydroxide for 2 weeks. That is the minimum time that you have to place a calcium hydroxide. Okay? Not lesser than that. But you should not place a lot of calcium hydroxide into the structure as well. Sometimes we keep changing dressing after every 2 weeks, 3 weeks. Maximum 2 dressings are sufficient. Ma'am, infected. The literature says that if you place calcium hydroxide a lot inside the root canals, it weakens the dentine more. So that is the reason we don't recommend that for about more than 2 weeks and 2 weeks, that should be sufficient. After that, no. So once the lesion is healed, the patient was recalled back, we opened it up, removed the entire calcium hydroxide, and then my process of placing the bioceramic starts. So we remove that calcium hydroxide, and then as it's an oval apex, so I have placed a gelatin sponge. Okay? So again, with the pre-fitted plugger measure, we pack the gelatin sponge into the apical area. We keep pressing it, and what you see here, you can appreciate here, this is the packed gelatin sponge with a slight drop of blood. So it's a good sign for me that it has reached to the periapical area as well, and I can start placing my MTA right there. So we have completely sealed with the gelatin sponge, there you can see that. And then followed by the placement of the MTA step by step. Again, it is a powder liquid system, what we have used here, because we have to put in increments and all. So once we have done that, we keep condensing with the help of paper points, so that we adapt the material very well into the root canals. Now this is the whole MTA what I have used. Okay. Now because it's a big, and there you can see that complete sealing. This is the complete MTA if you see at the apical area till the top. And this is the bioceramic sealer, that is the bioactive RCS along with your gutta-percha parts. So 3-dimensional sealing is again required in such kind of cases that then you can do it. But what we